Today, I'm addressing the elephant in the room, why your egg quality is not improving. Many women struggle with this, and in this video, I'll explain 5 key reasons based on both Western medical research and traditional Chinese medicine, also called TCM, that are often overlooked. I'm literally putting on my detective hat today. We'll explore what's causing each issue, how to recognize the signs that something is wrong, and most importantly, how to fix it. Stay until the end where I'll share a little known tip about improving both gut biome and womb health to give your fertility the boost it needs, especially if you are over the age of 35. The first reason why egg quality may not be improving is age. As we age, particularly after 35 when women are trying to conceive, the quality and quantity of eggs decline. But why does this happen? Over time, our eggs accumulate DNA damage from environmental factors like toxins, stress, and oxidative damage. This DNA damage makes it harder for eggs to fertilize and results in higher rates of chromosomal abnormalities leading to miscarriage or failed conception. From a Chinese medical perspective or TCM standpoint, this is where we call it kidney jing, Jing. This is where this becomes really important. Kidney jing is our life essence, which nourishes reproductive organs and overall vitality. As we age, kidney jing declines, which directly impacts fertility health. Think of it as a candle that slowly burns down with time. I'm sure you've heard burning the candle at both ends. Well, that's a common modern day epidemic for how we are constantly overbooked in our days. We're lacking self-care, health practice. A lot of it has to do with too much screen time. Let's look at some signs that things are wrong. And if you're having these, and you're probably already aware that having irregular menstrual cycles or reduced ovarian reserve, and this can be confirmed by an AMH test, and repeated miscarriage or difficulty conceiving despite trying for several months or years. How do we fix it? From a Western perspective or a medical approach, you can check your ovarian reserve with an AMH test and consider supplements like CoQ10. There's a lot of other ones, and I have videos on that. You can look at what has been shown to support egg health by reducing oxidative damage. Another option may be fertility treatments like IVF, but these are often a last resort when we're looking at holistic fertility care. But if you do decide to do that, then you combine it with holistic health care so you can get the best possible outcome, which is a pregnancy, healthy pregnancy, and a healthy baby. So let's look at the TCM approach. So in TCM, we focus on nourishing kidney jing with specific herbs like hushawu, which is Polygonum multiflorum, dongui, which is Angelica sinensis, acupuncture and acupressure, and stimulating seeds and patches. We also it's commonly used to stimulate blood flow to the reproductive organs and nourish the kidneys, which can slow down the decline in egg quality. If the kidney jing is supported early, it can enhance your fertility for years to come. I use patches and seeds with my long-distance fertility clients in my program, and I show them exactly where to apply them. It's very easy. A number of women don't like getting acupuncture because it hurts or they have anxiety, so this is a great option. A quick story about aging eggs. One of my patients from over 20 years ago, she was not a fertility patient. This is always fresh in my head when I see aging eggs. This can't happen. People get told all these horrible things. They're an incredible family. This patient came to me with allergies and recurrent sinus infections. After going through her medical intake, I asked if she was trying to get pregnant because she marked they hadn't used birth control. And she started laughing. She's like, "We tried for over 10 years. That's not happening." I still recommended using birth control, even though she said no way. They were in their 40s. They were okay at this point not to have kids. They didn't want to, go down that road again. And I said, okay, but I still recommend because we're working on inflammation. And I explained all the different processes that would impact because the body is a whole, like a tree, right? So if we're just like trimming this one section, it's only going to be a temporary. I have to look at all the root causes of the inflammation, and I explained all of that to her. let's fast forward a little bit. After 3 months of treating inflammation, improving her allergies to almost zero, and getting rid of sinus infections altogether, her and her husband showed up in my office. Yes, her and her husband, a little bit irritated because they're pregnant. Now, their entire world was rocked. They were shocked, but their little girl is now graduating college and has been the biggest blessing in their lives and her grandparents' lives. And I know them well too. So now just imagine what happens when I really focus on helping a patient to become pregnant with specific fertility herbs and treatment. Comment egg123 and I will send you my egg quality optimization checklist. And if you don't know me and you're new to my channel, I'm Dr. Gina Terinoni. Welcome. I'm a board-certified doctor of acupuncture and Chinese medicine, and I'm a certified women's healthcare practitioner in integrative medicine. I integrate 2,000-plus-year-old medical practices with the latest scientific research. In the past 23-plus years, I've helped over 2,000 women and couples over the age of 35 to become pregnant and have healthy babies. I would love to help you too. Please subscribe to my channel and click to get the notifications for my weekly videos that I make for all women all over the world. Oxidative stress is the second reason why your egg quality may not be improving. It's an imbalance between free radicals or unstable molecules and antioxidants in your entire body. This leads to cellular damage, including egg quality, decrease in egg quality, causing the eggs to age prematurely. What's interesting is that oxidative stress doesn't just happen because of age. It's often driven by lifestyle factors like poor diet, lack of exercise, exposure to toxins, especially environmental toxins like pollutions or BPAs that we find in plastics. Research shows that oxidative stress can directly damage the DNA inside eggs, making them less viable for fertilization. So what are some of the signs that show up that tell you something's wrong? Well, you've been trying to conceive for months or years and you haven't been successful, or you've had a miscarriage or multiple miscarriages. You've got hormonal imbalances such as irregular periods or symptoms of estrogen dominance, fatigue and sign of inflammation such as acne, headaches, joint pain, digestive issues. All of this can indicate your body's dealing with excess free radicals. There are a lot more symptoms. But how do we fix this? Well, from a Western perspective, so we're going to look at Western medicine, but also looking at functional medicine approach. We want to look at antioxidant-rich supplements like CoQ10, vitamin C, vitamin E. All of these can reduce oxidative damage and protect egg quality cells. Studies in the journal Reproductive Biology and Endocrinology suggest that these antioxidants can in fact improve egg quality, especially in women over 35. Regular exercise and a diet rich in antioxidants. So think berries, leafy greens, and nuts. All of these play a key role in combating oxidative stress. I have tons of videos on the fertility diet, on toxins, and also how to prepare and store food. So check out those playlists. And then we look at the TCM approach. Again, that's traditional Chinese medicine. That's my foundational medicine practice and study from over 25 years ago now. When TCM, oxidative stress, may be understood as an imbalance of yin and yang or internal heat. To cool and balance the body, herbs like goji berries or Lycium barbarum and Romania are used. These herbs are known for their antioxidant properties and are commonly used in fertility-supporting herbal formulas. Acupuncture can also be beneficial for reducing inflammation and stress, both of which contribute to oxidative damage. We've also got Tai Chi, Qigong. These can help with this as well. If there's any time that you're confused about the terms, drop a comment below. I'm happy to explain them to you. And I'll try to use simpler terms in this video so you can follow along, because understanding your body from a different perspective outside of Western interpretation, I find, is giving us all a much more well-rounded understanding of all the systems and how everything's interconnected. So third is hormonal imbalance. Hormonal imbalances are a major contributor to poor egg quality, especially when we're talking about conditions that women can have, like PCOS, polycystic ovarian syndrome, thyroid disorders, or insulin resistance anytime these are present. Hormones like estrogen, progesterone, follicle stimulating hormone, or FSH, need to be in balance for proper ovulation and egg maturing. So what causes these imbalances? Well, it could be anything from a poor diet to excessive stress to exposure to environmental toxins, or even the residual effects of synthetic hormones like those in birth control pills. Hormonal imbalances can interfere with egg quality by disrupting the normal ovulation process. So here's the good thing is that we can fix this. But first, let's look at the signs that something's wrong. In this case, when we're talking about hormonal imbalance, we're looking at irregular or absent menstrual cycles. Maybe you have one and then the next month it skips, or maybe 1 month it's a 28 or a 30-day cycle and the next one it's 50 or it's 70. This is starting to show things are shifting with hormones. Also, women who have symptoms of PCOS, such as acne, weight gain, or excessive facial hair. Those are some of the symptoms. Difficulty losing weight despite dieting and exercise efforts. That's a big hint that there's hormone fluctuation happening. And fatigue, low energy, or mood swings, which could indicate issues with thyroid function. So how do we fix this? From a Western perspective, we can look at, and this could be more like a holistic approach, okay? So this isn't something that I find my patients or clients that come to me get from a Western doctor, but there's different paradigms under that functional medicine. And then you've got several other healthcare practitioners. We often talk about this in traditional Chinese medicine as well. So we do want to encourage regular exercise, a diet rich in healthy fats like avocados, fish, and specific supplements that we can take like omega-3 fatty acids or vitamin D and magnesium can help restore hormonal balance. Supplements like inositol can also support women with PCOS or polycystic ovarian syndrome by improving insulin sensitivity and regulating menstrual cycles. Now, the TCM, the traditional Chinese medicine approach, sees hormonal imbalance as disruption in the flow of energy. And you will often see that called qi, QI, CHI. There's different interpretations, and also disruption in energy or oxygen and blood. So we'll look at herbs like Vitex or chaste tree berries. These can help balance estrogen and progesterone, and acupuncture and acupressure, patching, can help to regulate menstrual cycle by improving blood flow to the uterus. Practitioners often recommend, like myself, a combination of herbal medicine, acupuncture or acupressure, or patching, and stress reduction techniques to restore hormonal harmony in your body. If you're ready to take control of your fertility, improve your egg quality, comment the word egg 123 below, and I will send you my egg quality optimization checklist. It's packed with tips on how to boost fertility naturally. And don't forget to subscribe to this channel, please, for more fertility-focused content. And if you're looking for deeper support, you are so welcome to book a free consultation with me. See the comments for a link to my personal calendar. Number 4 is environmental toxins. So environmental toxins are often an overlooked factor when it comes to egg quality and overall fertility health. It's kind of wild that people don't talk about this because our toxins are everywhere, so we have to look at how to minimize them. Substances like BPA, phthalates, pesticides, heavy metals such as mercury and lead can disrupt your hormones, damage your egg quality, damage the eggs, and impair overall fertility health. Studies show that women exposed to high levels of these toxins may experience reduced egg quality and increased difficulty in getting pregnant. If you work in an environment, and I will name a few, like a hair salon or a nail salon that uses chemicals, or cosmetic factories or stores, agricultural production, textiles, garment manufacturing, or even stores, because when you open the packages, all the fumes will come out, or rubber production like tires, or working in a tire store. Those strong smells, that is not good for fertility health or egg quality. So Think about, I always see a lot of women working in automotive or electronic stores, anyone working around janitorial services. This is so important because I have a lot of clients and patients that are doctors, nurses. So anybody that works in hospitals, schools, industrial buildings, printing, ink presses, dry cleaning. I can go on and on. Sometimes we don't think about it because there's so many people there and we just kind of get on with our day. But I have videos coming up that address how to minimize the impact of all these chemicals that are in our work environment. Let's look at some of the symptoms or the signs that something's wrong and maybe we've had some hormone disruption due to these toxins, and that's what's impacting fertility. So difficulty conceiving despite normal fertility markers. Frequent exposure to plastics, pesticides, or heavy metals. So using non-organic produce or food or vegetables, fruits. Plastic water bottles, having mercury fillings can be a problem. But you have to consult with your dentist on this one and try to find a holistic dentist, because I know that a long time ago I had gone in and said, I want all the mercury out. And when I did the research and they did the research, they said, oh, then it would leak in your mouth. And actually that would create more problems. So talk to your dentist and get a recommendation there, because what I do is personally, I have them replaced as they're cracked or falling out. That's my choice. Hormonal disruptions such as irregular periods or unexplained infertility. There's so many signs. How do we fix this? The best way to reduce your exposure to these toxins is by making some lifestyle changes. And it takes time. I totally get this. Avoid plastics, especially heated plastics. So you don't want to put a plastic container in the microwave, or we don't want to store put hot food into Tupperware, and then that's kind of heating, and then we put it in the refrigerator, and then it's baked into it. And switch to glass or stainless steel containers. Eat organic whenever possible. Limit exposure to pesticides by thoroughly washing fruits and vegetables. A detoxification protocol, you can use that, but that has to be under the guidance of a healthcare provider. This can be dangerous when done on your own. I help clients with these, but it really depends on the timing. And often you have to separate at least 3 months, sometimes 9 months or longer before actively trying to conceive. The benefit is that you can clear heavy metals from your system. But again, it's very dangerous to do if you don't have training or experience with that. So what is the TCM, traditional Chinese medicine approach? For environmental toxins, they're seen as, it's interesting, external pathogens. So we see these toxins that are coming in externally, and they disturb the natural flow of energy in the body. So we tend to recommend, depending on the person, herbs like dandelion or chrysanthemum. They're commonly used for detoxification, clearing out the liver, supporting the body's natural ability to eliminate toxins from the body. Detoxifying foods are helpful, like bitter greens, lemon water. Foods high in chlorophyll can further aid the process. And then combining that with acupuncture or acupressure or the patches or the seeds I was talking about, all of these things together can improve circulation and lymphatic flow. Number 5, lifestyle factors. Your overall lifestyle is playing a significant role in egg quality. We've got to talk about this. The good thing is that lifestyle factors can be improved. We're looking at stress reduction, improving a poor diet, working on sleep problems. Having lack of sleep is terrible for fertility health. And then an overall sedentary lifestyle can all negatively impact fertility and egg quality. High levels of stress raise cortisol, which disrupts reproductive hormones, and it impairs ovulation. Poor nutrition deprives your body of the nutrients it needs to produce healthy eggs. All these things are connected, remember? I have worked with thousands of patients and I see patterns on what is going on. And so that's what I find out when I ask all these medical intake questions and come and see the patterns. So signs that something's wrong: high levels of stress, anxiety, or difficulty managing stress, poor dietary habits such as eating a diet high in processed foods and sugar, But also, again, like looking for the clues, some women that have digestive challenges, poor absorption is due to eating raw foods. Don't come at me. There's so much proof for this. I do talk more about that in other videos. Lack of physical activity or irregular sleep patterns can also be signs that something is wrong. How do we fix this? A Western perspective is a fertility-friendly lifestyle, including stress management, techniques like yoga, mindfulness meditation. I have got yoga and mindfulness meditation coming up soon, so please subscribe. I'm so excited. This is my first time releasing these on YouTube. Deep breathing exercises as well. A balanced diet rich in whole grains, lean proteins, healthy fats, plenty of fruits and vegetables, that's essential. Exercise is equally important as we talked about before, but it needs to be moderate. Extreme exercise can actually harm fertility health. This all depends on the woman. I have worked with pro and semi-pro athletes, and we've had challenges with them getting pregnant. So it just really depends on the person. Traditional Chinese medicine approach emphasizes the importance of balance in life. I feel like we've really lost balance, especially in the last 5 years. I really see that so much now, and it breaks my heart. I am not immune to that either. I've had to work really hard, and I do work on daily scheduling for stress reduction, self-care, these kinds of things. But looking at techniques like Tai Chi, Qigong, specific meditations that help reduce stress, promote mental and physical harmony in the body. I've got a video coming up on meditation specific to fertility. In terms of diet, TCM recommends warm, nourishing foods, such as soups and stews with specific proteins and vegetables. And then we have different herbs that we actually cook into the soups and stews. They're easier to digest. They also support the spleen and kidney systems, which are very important for fertility health. Sleep is another key factor. Getting at least 7 to 8 hours of restful sleep helps balance hormones and supports overall health. It's a good idea to be in bed asleep no later than 9 or 10 o'clock. Of course, this is going to depend if you have an overnight shift. Let's talk and strategize that together. So, womb and gut biome. Now, let's talk about this. It's often overlooked, but it's a critical factor. Inflammation in the gut and womb biomes, these two systems are so linked together. If there's inflammation in the gut, it can affect your womb and vice versa. Chronic inflammation can disrupt hormone balance. It hinders nutrient absorption and negatively impacts egg quality. How do we fix this? Healing the gut and reducing inflammation starts with diet. It really just starts with diet. Incorporating anti-inflammatory foods like leafy greens, turmeric, ginger tea, or just like shaved up ginger and putting that on top of vegetables, or putting that in soups or stews. Perfect. Fermented foods can be really helpful for some people to restore balance. In traditional Chinese medicine or TCM, we focus on nourishing the digestive system through warm, easy to digest foods, avoiding cold and raw foods, which can put a huge strain on the spleen and stomach and whole digestive system. You support a healthy womb environment, which is essential for conception and maintaining a healthy pregnancy, right? Getting pregnant is step one. The next phase is maintaining the pregnancy and then preparing for a healthy birth and delivery and recovery in postpartum. If you're ready to take control of your fertility and improve egg quality, comment the word egg123 below, and I will send you my egg quality optimization checklist. It's packed with tips on how to boost egg quality and fertility naturally. And please remember to subscribe to my channel for more fertility-focused content. And if you're looking for deeper support, you are so welcome to book a complimentary consultation with me. See the comments for the link to my personal calendar. So improving egg quality, it isn't just about age or taking supplements. It's a holistic process that involves addressing oxidative stress, hormonal balance, environmental toxins, and lifestyle factors. By combining the wisdom of both Western medicine, sometimes functional medicine, and absolutely traditional and natural Chinese medicine, we can work together naturally to support fertility and improve the chances of a healthy pregnancy. Stay proactive, listen to your body, take these steps to give yourself the best possible chances when you are trying to conceive. Be sure to subscribe and watch for next week's video on ovulation, understanding your fertile window, and cycle tracking. See you then.